So in this project, we used de-identified data from the Manitoba Center for Health Policy repository, which is a collection of databases that allow us to study the health of Manitobans without identifying individual Manitobans. We looked at the patterns of change over time in antibiotic prescription from 2011 to 2016, as well as how those antibiotic dispensations linked to physician visits. We found that in 2016 compared to 2011, there were 67,000 more antibiotic prescriptions. Use of antibiotics was highest among adults 65 and over, and as well as in children under the age of 5. When we looked at the link between antibiotic use and the reason that the physician gave for giving the antibiotics, we found some worrisome patterns. We found that over half of the time when children were given antibiotics for pneumonia, they actually received the wrong antibiotic as per guidelines. So that those antibiotics would drive more resistance. And again, that's not the most appropriate use of antibiotics. We also found very concerningly that for bronchitis, or what is often called a chest cold, a condition that does not need antibiotics, almost 3/4 of the time Manitobans were being prescribed an antibiotic. And so we need to look further into that. We found that when Manitobans were diagnosed with a UTI or a bladder infection, they were getting antibiotics, which you should for a bladder infection, but the one that was used most of the time for bladder infections kills more than just the bacteria causing the infection. So again, it's stronger than it needs to be. We found a wide variation between different physicians in how often they prescribed antibiotics for certain conditions. We did, however, find that when we looked at the link between physician characteristics and antibiotic prescriptions, that there were some trends. So older physicians and physicians who had a busier practice, those that saw more patients in a day, were more likely to prescribe antibiotics. We also saw that when patients saw their regular doctor, they were more likely to receive the correct antibiotic for a condition and less likely to receive an antibiotic where one probably wasn't needed.